Hi, everybody. Welcome. Good morning or afternoon, depending on where you may be joining us. My name is Matt, and I just want to first say thanks so much for choosing to spend your time with Provider Trust today. We hope you enjoy the session. So, we are lucky to have our co-founders here today, Mike Rosen and Chris Redditch. This is actually our first webinar in 5 years that we've been able to get them both together here. So very lucky to have them both. Mike has about 30 years in innovating HR and compliance solutions and comes from a legal background where he's just passionate about finding those risk mitigation solutions and sharing those with healthcare professionals. And Chris Redditch has 20 years of entrepreneurship under his belt and really focuses on the vendor compliance side of our business, and is just passionate about helping healthcare folks as well, finding those solutions. So they got together and came up with a great idea, and now that's why we are all here today. So we're happy to have you guys both here to talk about healthcare fraud in the supply chain and how to protect your organization during and beyond COVID-19. So a little bit about us. We are a software as a service company here in Nashville, Tennessee. We have partners here in Tennessee and across the nation, some on the phone today. And we believe that a smarter healthcare makes a safer healthcare. And we live this out by monitoring healthcare populations to identify compliance and credential issues before they impact patients. So before we start, I want to give you guys a couple notes. You will be receiving a recording of today's presentation as well as a copy of the slides to share with your colleagues or whoever you think may find this valuable. This webinar is also good for one CEU. We are waiting to receive that certificate of completion from the Compliance Certification Board. So as soon as we get that, we will be sharing that with all of you. And also, we just want to say thank you for everything that you guys are doing to support the front lines of COVID-19. We are here for you and want to help you in any way that we can. So please don't hesitate to reach out, chime in on the survey after the webinar today, and just let us know how we can help. We also have a few resources for you guys that are COVID-19 specific, and we just hope that those are helpful and you can use them if they're valuable to you. But with that, I will go through today's agenda and hand it off to Mike. So we will start with the supply chain fraud and risk, then move into the impact of COVID-19 on all of this. Then we'll talk about vendor compliance, vendor and supply chain challenges, and then wrap up with vendor monitoring best practices. So there is a Q&A, there is a little tab on your control panel there where you can chime in with any questions that you may have. We have some minutes at the end of today's presentation to go through some of those. So chime in if you would like us to talk about anything in particular. And with that, I will hand it over to Mike Rosen to talk about supply chain fraud and risk.
Okay, thanks, Matt. Well, hello, everyone. I hope that this time finds you well, and that this new normal that we're in, you're settling into. Of course, the most sexy topic in the world is supply chain management and risk and fraud. But in all seriousness, this is actually very topical right now because of the immediate need and the exacerbated need for all kinds of supplies. And probably you're finding yourself, like we understand most of our clients are, having to supplement what you already had in place in order to move forward with the extra need you have for all types of things in that supply chain. So we're going to talk about fraud and risk. First, thought might be important to educate you a little bit or bring you up to speed on the state of healthcare fraud as it pertains to procurement, in particular with contracting with vendors. So I was a little surprised when we saw this from Pricewaterhouse's 2020 Economic Crime and Fraud survey, but they found that 20% of organizations say that vendors and suppliers are the source of their most disruptive external fraud. Now, of course, we're not talking internal fraud here. That's a whole nother animal. But as far as the reliance that you have on third parties to help you do your jobs at whatever the facilities and or organizations that you work for. Vendors and suppliers are paramount to getting that job done. And so if you have a 1 in 5 chance that you're dealing with somebody that may not be who they say they are, or may have had a fraudulent history or past, or currently involved, that's not good. So what does that equate to when you look at it from the broader healthcare scheme? According to the National Healthcare Anti-Fraud Association, a recent survey showed that that can cost taxpayers $68 billion. These are real dollars, and they add up fast. These players are out there, and there are ways that you can be better at determining and vetting who you're doing business with to avoid them. Next slide, please. So what does vendor fraud look like? Well, it can cross a lot of different areas inside your organization, stemming from simply breaching the contract. They can overpromise you the world, sound great, and if you don't do enough diligence on them on the front end, they may not be in any way, shape, or form capable or able to provide you with the materials that you need, and they would be in breach of contract. But that doesn't help you, because now you can't perform your services and you have to pursue them for breach of contract. Even worse, as it rises the ladder of fraud, would be kickback schemes. So are they involved in some type of payment or kickback with either your organization, someone inside of it, or surrounding them, that brings about all kinds of kickback problems, and the Department of Justice knocking on your door because of kickbacks and illegal payment schemes. False claims, I'm always interested that I hope you find this interesting too. The False Claims Act actually started right after the Civil War. It was designed because suppliers for the military, civilian companies were supplying the military back in the 1860s with fraudulent items, or items that, bullets that didn't work, muskets that were inoperable, and it's fraud. So they were defrauding the federal government. Now, fast forward to today, we know False Claims Act is the favorite sword and tool of the Department of Justice and the OIG to pursue when they see false claims being submitted in various forms by healthcare organizations. And then, of course, the ultimate, problem, or the ultimate infraction, can result in an individual or a vendor or owner of that vendor becoming excluded, and therefore you can't contract or do business with them. So this is the broad spectrum that affects vendors. Now, we call this, when people are trying to avoid this, hiding behind the corporate veil. And I wanted to highlight this case for you because I think it's pretty enlightening. This case was a settlement of over $3 million in Pennsylvania back in 2018, involving a Mr. Martinez, who himself had been convicted of Medicaid fraud in the state of Pennsylvania, the Commonwealth of Pennsylvania, in 2000. Now, he knew he was excluded, but he wasn't going to let that prohibit him from continuing to build a government. And as a result, he was not eligible for receiving any federally funded healthcare program dollars, including Medicaid or Medicare. So what did he do? Mr. Martinez, who is now excluded, was prohibited from owning, managing, or receiving payments from any healthcare provider. The lawsuit brought against him and his wife, who assisted him in the fraud, showed that he continued to operate and formed new organizations, community healthcare clinics in North and throughout North Carolina while he was excluded. He did this by falsifying on his enrollment form that he had no ownership, only his wife did. And yet the case found that he was actually involved in administrative functions and actually was running the business behind the corporate veil. So here's an example of how the OIG is just not going to tolerate that. And they're looking for people who are trying to profit when they are in that excluded status. And this may be news to you, and you may never have even thought that not only do you need to worry about the status of the vendor company that you're dealing with, but you also, according to the OIG's guidance in 2018, need to know if the owners or administrators owning or being involved in owning more than 5% or being involved in administration are in fact associated with that company. So take a look at this case on your own time and see, it's cost this company $3 million. And of course, not a good place to be when you're already excluded. So the next slide, we're going to ask a poll question. Matt, why don't you launch this question?
Yeah, we have 3 polls today. This is the first one, and we're just curious who at your organization is responsible for vendor and owner screening. We're curious at who that may be. Maybe it's compliance, supply chain, strategic sourcing, contract compliance. And if it's a different department that's not listed here, just chime in the Q&A section there and let us know. We're curious at where this responsibility lies. So we'll leave that open for about 5 more seconds. And we'll go ahead and end and share those results.
Fantastic. So Matt, it looks like with well over 150 people on this webinar, you know that on this call are other people that come from various departments, compliance being the largest, but also you have supply chain, procurement, sourcing, and accounts payable. So, and then of course, a lot of people are not sure how that's handled in your organization, and that's fine. I would suggest that maybe you take some of the things you learned here today and make sure that you pass this on to them so that you can get a comfort level they're doing what is necessary to protect you. Chris, why don't you talk about the COVID-19 impact on vendors, especially with PPE in this time?
Yeah, thanks, Mike. And Matt, it's thanks for inviting me onto a webinar. It's been a while, right?
Yeah, it's great to have you back.
So one of the interesting things with that we get to do is we get to look across an industry, and we're monitoring in terms of our business hundreds of thousands of vendors for our clients on an ongoing basis. And so when COVID-19 hit, we began to get quite a number of calls from PPE suppliers and non-traditional PPE suppliers. And I'll share a few of those stories here in a few seconds. But what's interesting is during the crisis, Cardinal Health reported that 67% of providers and clinicians feel that the supply chain issues have heightened frustration. So I don't know if you guys saw some reports coming out of New York, but there were nurses and healthcare professionals that were actually wearing Mets rain day gear, and so PPE was in such short supply there in New York that they were having to go the non-traditional route. So the reason for that is obviously there's an increased demand in PPE, but that was not just in the domestic market in the United States; it was actually around the world. And then the other thing that was really challenging is as these non-traditional PPE suppliers popped up, how were you as a healthcare organization, how would you deem whether or not they were legitimate suppliers? And so it just added to quite a bit of frustration across healthcare. And we received quite a number of calls, and I'll share those here in a little bit. Next slide. The other thing to kind of think about along this is not only is it equipment, but it's also training. So OSHA came out with, obviously their standards where they're focused on equipment. But the other thing is also being prepared from a training standpoint. And I know from compliance, you guys are focused on that. But here are a few links that if you're wondering, just from a safety issue standpoint, that we'll be supplying to you as well. Next slide. Late one night, I was actually on a Saturday night in the middle of March. So the NBA had just shut down sports, and that's kind of where my mindset kind of goes to kind of that marker point where the economy and the domestic market really started shutting down. I got a phone call actually ended up having some phone calls with a couple of non-traditional PPE suppliers. My first instinct when I got these phone calls was, how do I know if these PPE suppliers are real? Are they going to have the equipment. If they do have the equipment, is it going to be certified? Is it going to be a good equipment? And so these were some of the questions that started running through my mind. At the same time, the FBI was releasing, some advanced warnings around fraud in healthcare. Some of the things that they pointed out was unusual payment terms, and we'll look at a few of those cases here in a second. Last-minute price changes. So there's actually federal laws against price gouging during emergencies. Last-minute excuses and delays in shipments, and then also unexplained sources of bulk supply. One of the individuals who I spoke to was actually out of New York. They were trying to get in contact with some of our clients, and they had anywhere between 100,000 to 500,000 N95 masks. And when I started asking more questions, they were coming out of China, and it was through a relationship, and ultimately did not pass that information on to our clients. But it really started getting our mind thinking, how do we help solve this problem, not only for acute organizations, healthcare organizations, but also post-acute. They don't necessarily typically have the staff to begin to source non-traditional PPE supplies, and we'll talk about how the post-acute healthcare sector was impacted as well. Next slide. Here just some examples. There's a Georgia man. There was a case was arrested for defrauding the VA. Over $750 million worth of PPE that could not be supplied. N95 masks ordered. FEMA ended up canceling a $55 million order from a Virginia company. I remember seeing that on the news. And then these are just one of hundreds and thousands of cases, some that haven't even been reported. But as you guys know, PPE during COVID-19 and currently is a struggle. So next slide. One of the things that we kind of came up with in monitoring vendors for our clients, we're monitoring hundreds of thousands of vendors on an ongoing basis. We created this thing called the marketplace. And so what it is a place for vendors to come, put their information. Can we go back to the next slide? And also to be able to create basically categories. So Corsair Distillery, we're out of Nashville, Tennessee, and they are actually a local alcohol. They make wine and spirits, and they very quickly transitioned their business over to making hand sanitizer, if you can see in the upper right-hand corner. Sign Depot is another one. They were making face shields. So what we did is we allowed these traditional and non-traditional healthcare vendors to sign up. They were able to sign up for free. And then healthcare organizations, both acute and post-acute, would be able to very quickly search and find both traditional and non-traditional PPE suppliers. And so we've had a lot of our clients and non-clients be able to utilize this website. If you go to marketplace.providertrust.com, it's free. All the vendors did not pay to sign up into the marketplace for COVID-19, and they were able to update specifically what they did provide. So this was just one example of how the industry, and there's lots of other examples of entrepreneurs and individuals help try to solve this issue. Mike, do you want to talk a little bit about more about vendor compliance and what that looks like?
Sure, let's do a poll.
Or I think we have got a poll next.
Yeah.
Yes, this is our second poll here. Yeah, we appreciate you guys chiming in. And yeah, our question for this one is, how often is your organization screening vendor owners? We know that this can be an easily overlooked part of the compliance process, and we're just curious where you guys sit with that. So we'll leave this open for about 10 seconds, try to give everybody a chance to vote. And we will close that out and share those results.
Okay, excellent. So I think this shows that owner vendor screening is news to a lot of people, and you're not alone. This is not something that a lot of people have picked up on, although it has been made clear by the OIG earlier than 2018, but most recently in their revised guidance in 2018, that you need to be searching owners. So we see that a few are doing best practice of daily and or weekly, monthly being the almost majority, or at least the largest percentage, which certainly is at minimum what is required. Annually or anything beyond, certainly or never, is not a good idea for the reasons that we're going to show you just in a second. So let's talk about the actual compliance that is something you should be incorporating or bolstering in your current program. So as we've said, here is the link that shows and the recommendation as well as guidance from the OIG about why you have to search not just vendors and entities, but actually owners that own more than 5%. Now, there are some exceptions, publicly traded companies, things of that nature, but for the most part, again, think of the case where Mr. Martinez himself was excluded and knew that he was, so he thought he'd be smart and form various community health clinics and have them, quote, owned by his wife, yet he was actually running them, and he actually was, if you check with Secretary of State, an owner of the company of more than 5%. So the OIG for HHS does have the authority, has excluded entities, and has gone after and continues to the owners who try to hide behind the corporate veil. And actually, we get a chance to speak with the regulators at the OIG at the HCCA fall conference in DC, and I asked a couple of them, certainly some of the prosecutors, what really gets under your skin in the realm of fraud in general, and they were very quick to say, we really don't like it as a whole, but specifically those that think they're outsmarting us by hiding behind the corporate veil, and it just really gets under their skin, and they're going to go after it. So the OIG recommends that at least on a monthly basis, which was good to see 30% of you doing that you search not just the company as an entity itself, but any of the owners that own 5% or more, and look to see who are some of the administrators of that organization. So even if a physician himself or herself is excluded and yet hides behind the veil of a legal entity or that of his spouse or her spouse, but is actively involved in billing, reviewing bills, providing services, any type of administrative service, that opens you up for some liability. You want to learn more, please take a look. There's some specific language and recommendations here in this guidance that was from 2018. Next slide. Now, so you're thinking to yourself, okay, maybe I didn't realize that, or I didn't realize the OIG really was going to go to that level for compliance, and they are. So let's talk a little bit about what's the best mechanism for limiting your civil monetary penalty liability. That's the fines that they have the authority to go after an organization like yours if you fail to find and or contract with an entity or owner who is excluded. When you look at the guidance itself, they tell you, pretty broad guidance, they tell you to treat vendors just like you would employees. So whatever you're doing for them, you should be doing for your vendor populations, and then determine whether to screen what contractors. We get asked all the time, does that mean the florist that delivers flowers, or the person who from Instacart who comes and brings food to your break room? And use common sense there. What we're talking about is if you could follow the federal healthcare dollar, that's a problem, and the OIG will come after you for it. So most organizations require their vendors, through the contracts that they sign with you, that they contractually agree not to employ anyone who is excluded. And yet the OIG says that's nice, but that doesn't alleviate your liability. You, the organization, has to determine by asking or at least auditing or doing something more than checking a box saying, yeah, it's in our contract. They said they wouldn't do this, to avoid the liability. So next slide, please. In particular, if you handle Medicare Advantage, for those of you on the call that do payments and reimbursements, This is even much more onerous and specific. And we could do and we have done an entire webinar on this topic. So I'll just let you know that first tier downstream related entities, FDRs as they are called, require even more of just checking whether the company or owner is excluded. You actually also have to determine that they have a code of conduct. They're either abiding by yours or they have one that you've seen. You have to certify that you're doing exclusion screening on them, and they have to show that they've done it, demonstrate that they're cooperating. There are things with regard to limitations of offshoring requirements, and then whether or not there's a business associate agreement required because they handle PHI. There's specific things that have to be asked, that have to be obtained by you, the organization that contracts with them, and audit those to make sure you're complying. Again, if you would like more information, we've done blogs on this. We've actually done an entire webinar on this, and they're on our website for later review. All right, Matt, I'm going to round this section out and hand it back after a polling question to Chris, talking about what is the role of procurement and compliance, two groups that probably don't always like to work together or get a chance to work together, or in some cases, ever think to try to plan and work together, but really key areas in both, in any organization, both the compliance department and procurement. Why? Because compliance is ultimately responsible to certify to management. And in some cases, if you're in cases in which you're under a corporate integrity agreement, they're actually telling management, yes, you can sign this certification to the OIG that we are doing X, Y, and Z. Personally liable if they're not. So compliance has an oversight responsibility to make sure procurement and sourcing is doing the things that they should be doing on the front end. So that includes the agreement, the language, the ability to verify it before you give them some type of vendor code, and auditing those so that compliance knows that you're in compliance with those areas. So really two areas that not always get a chance or take the opportunity to work together, but are really key to bridge the gap. All right, Matt, launch our question here.
And this is our final poll question of the day. Thanks again for participating, everybody. But our question is, if you contract with vendors that handle protected health information, what do you estimate the number of signed business associate agreements your organization has received? So I know that's a long one. Think through that and let us know. We're curious if that's on the lower end at 0 to 25% or on the higher end at 75 or greater. And if you have no idea, that's okay too, because when Mike posed this question to me, I didn't know what he was talking about. So I totally understand.
So Matt is at least, he'll answer the last one. That's his answer.
So we'll leave that open for just a few more seconds, and then we'll share those results.
Chris, I'll let you handle this one because I think this ties in nicely with the next section you're on, but this is not surprising from what we see.
Yeah, typically when we're looking at organizations, they're typically in that 50 to 75% range. 75% or greater is pretty impressive just in terms of from a sign standpoint. I know there's been lots of communication both from a vendor standpoint and a healthcare standpoint on the associated risks of BAA. So 75% or greater is a great number for the healthcare organizations. I'm going to talk a little bit about the challenges that we see. Again, we're monitoring hundreds of thousands of vendors for our clients on an ongoing basis. And this is just a few of the challenges that we see. Obviously, efficiently monitoring vendors and their owners for exclusions. You'll see in a little bit later in the presentation, we'll walk you through a data integrity scrub where we're actually looking at the accuracy of vendors' data. And when we say vendors' data, we're just talking about the business information. So the business name and the TIN or EIN number of that organization bumped up against the organization. And we typically see anywhere between 40 to 70% accuracy. So to be able to collect the ownership information and keep it updated is a pretty big challenge. Obviously, that leads into the second of incorrect or incomplete data. We'll talk a little bit about that and show an example of how data gets old pretty quickly in the vendor space. It's very hard to change your name and your social security number, but it costs about $500 depending on the state where you live to set up a new business and set up a new owner. And so as Mike talked a little bit earlier about just hiding behind the corporate veil, that's typically where we see a lot of the fraud within the supply chain is these scrupulous excluded individuals or not truthful owners actually just set up entities after entities after entities and continue to operate within their existing network of healthcare, but behind what we call the corporate veil. And so this information is constantly changing and keeping up to date. Decentralized data housing. I remember when I got started as an entrepreneur, I thought payment information would be really easy to get access to, just in terms of who healthcare organizations pay or businesses in general. But as you kind of get into it, you start seeing that it's really hard because it's decentralized. And typically, especially in large organizations, you'll have cuts check at the local location. You'll have credit cards being used for convenience, but then you'll have a centralized or corporate account, so that it's really in 2 or 3 spaces. A lack of standard vendor onboarding process, and this is really related to kind of the transition from paper to electronic. As things get faster and the need for supplies and service gets faster, we have to really change our processes to try to keep up with those times. And a lot of times supply chain or supplies for vendors just is kind of the last go around just in terms of technology. And then also just the hard and soft costs. It's very costly if you're not leveraging technology to try to keep all this information centralized. And so those are kind of the challenges that we see. Mike, let's go into kind of best practices and kind of end on a positive note. Next slide. So what do we see that works? Obviously, and this is kind of a checklist. If you're thinking about something that you could take with you, and kind of five kind of topics or questions you could begin to ask your organization is decide which department or team owns vendor compliance data. We have a pretty robust accountability chart at Provider Trust in what we do and try to spread out our accountability and make sure things rolled up. And so just really determine what department or what team is going to own it, and then who is going to own that. Centralize your organization's vendor data. So a lot of times because of roll-ups or large organizations, you're going to have different systems. But there are ways through technology to kind of centralize that data. And so trying to think outside the box, like how do we get all this data into one place in a really streamlined way, and just begin to ask those tough questions. Update vendor data. So we'll show in a few slides where we talk about how data changes. As Mike talked about earlier on, FDR attestations and Medicare Advantage attestations, those need to be done annually. And so when you're beginning to develop your system and develop your processes, don't just think about it as a one-time exercise. Because if you're thinking about it on a one-time exercise, it's going to be stale the next day. And so try to think about and build your systems around kind of this ongoing updates. Collect owner attestations and identifying ownership data. This is really hard because a lot of times you're rushing to get vendors especially as we've seen in COVID-19. You're rushing to get these PPE vendors into your system. You're rushing to get them paid because there are people that need supplies. But being able to collect that ownership attestation up front, we see a lot of times if an owner is excluded, they're not going to do business with you. They're going to choose to opt out. And so being able to collect that information on the front end is very, very important. And then just documentation of employee monitoring. This is really becoming evident. We start seeing it move from kind of the West Coast over to the East Coast, just in terms of Medicare Advantage plans. But no longer are they allowing you to just say that contractually we have that information. They actually want to see documentation. And that really goes down to not only monitoring the entity and the owner, but the employee as well. We've had a few clients before implementing vendor proof in our Engage product, where they were getting fined last year $130,000 and earlier this year about $150,000 for an employee of a vendor that came into their hospital who was excluded. And so through some routine audits, they were able to, the auditors found this information and they were fined. And so really just kind of thinking about it from an ecosystem standpoint. How do I build a system that is able to collect information? It's centralized. It can keep things updated, but then you could collect the appropriate attestations and documentations that you'll need. Next slide. This is just the solution. So we talk about, any organization that we work with is going to have both existing and new vendors. And so you kind of got to treat those populations different. Existing vendors, you're going to need to go out, they're an existing vendor, you're going to ask them to fill out more data and more information than they might have when they were onboarding. So be conscious of that. And then obviously you have your new vendor process that is a lot easier just in terms of the sign up. We've created onboarding, electronic onboarding. So we have an application and a website that's able to collect that, and then very quickly monitor that information and verify it. You'll see in the next slide with a data integrity scrub around verification of the data. So good data in, good data out, bad data in, bad data out, and then the reality is that you have to keep it updated because as we talked about earlier, it's very hard to change your name and social security number. You got to get divorced or go to court, do all those things. Creating a new business entity is really easy and just costs a couple $100. And so making sure that you're constantly updating that data and refreshing that data. And then also being able to access that for real-time reporting. This idea of being audit ready all the time is, as we move into the digital world, is not just a nice to have, it's becoming a requirement. And so being able to not only have real-time reporting, but being able to access it online. We've seen a pretty big uptick just in terms of interest in our product and our processes related to supply chain teams having to work mobile. And so they're not able to work at the hospital. And so they're needing to have this entire process online. And so really thinking about that. Next slide. This is an example of a vendor data integrity scrub. So this is a sample client, about 7,000 vendors. If you're marching down the left side of the page, you have data integrity, data quality, and completeness. And so we took those 7,112 vendors and we bumped those up against the IRS. 3,890 matched. 2,548 didn't even have TIN numbers, so we didn't even submit those. If we of the vendors that we did submit, 674 had invalid IRS match. So the idea of, I would say that that's an example of data that's changing. There were no NPIs, license numbers, DUNS numbers, and no ownership information, mainly because that's just really hard to collect and keep updated. But there were 4 matches for exclusions. And as you can see on the right-hand side, the average fine was $129,000 in 2018. So we gave them a data integrity score of about a 54.7%. You might think, wow, that's crazy. That's not very good. But that's actually right on par with what we see across the industry, if not above typically where we see clients when we're working with them. The next slide shows just how data changes. So this was kind of a case study. This hospital or organization, we took 2 of their hospitals. We asked 455 of their vendors to sign up. You can see they signed up. They had valid PINs, valid addresses. There were no duplicates. On the right-hand side, you can see all that stuff matched. We also collected risk assessment. 50 of the vendors were FDRs, and this was done before we required ownership information, but 55 of the vendors provided their ownership information. On the next slide, you'll see 6 months later, they had a data integrity score of 100%. 6 months later, 55 of those 455 vendors their data was changing. And so it was not accurate. If we can go back to that last slide. Here we go. So over 6 months, you could see they dropped almost 13%. So you could think that over the course of a year, you're looking at about a 20% change of vendor data. So as we talked about before, it's not only important to collect the information, but really to create systems and processes, whether internal or external, you use an external vendor, but you not only want to collect it, but you want to keep it updated. Mike, do you have anything to add kind of around that before we jump into Q&A and questions?
Yeah, sure. I think the statistics are interesting, and the last point that you raised of what changed in just 6 months would be kind of frightening if I were in the shoes of procurement. Already we know from our experience that, and through no fault of any organization, we say it, Provider Trust, if you've seen one organization, one healthcare organization, you've really just seen one. But what we do see kind of as commonality amongst on the procurement side, your groups have not been, your departments have not been adequately funded and probably given the attention that you've screamed for years, because it's not the group that most organizations who are focused purely on the care side or trying to avoid larger fraud and billing and those kind of things. You know, procurement gets left behind a lot. And if HR always complains about, we don't have enough resources, I always tell them, well, you should try procurement, because they're the least funded in most organizations and the ones that really get the last dollars, if any. So you've had to build and scrape and scrap and get these things built. And that's why we see in these data integrity scrubs that the data is all over the place. Really, as Chris indicated, a 54.7 score sounds, you know, when I was in law school, that wouldn't help me get to the next, class, but really that's high. And a lot of that's because you have not had nor thought about systems that you need to collect the information that the OIG is expecting you to. And now that they're coming out with these guidances and or the Medicare Advantage requirements saying, and a lot of these existed, you probably didn't realize that they were in the contracts that you've signed, that somebody and management has signed for your organization to do business and or receive Medicare and Medicaid payments. They've signed a contract that whether someone in legal explained to procurement does require you to do these things. So here you are, you've been dumped on all of this responsibility, and we've watched some very large enterprise organizations of ours that are roll-ups of hospital systems, and they're trying to get everything into one system now, Lawson. And what they're seeing is echoing what we're showing here, and that is a lot of the time there was never consistently even a tax identification number collected. Now, I'm sure somewhere along the way it was asked for, And maybe even there's a paper file at the hospital. But in actuality, that doesn't help you be audit ready, like Chris talked about. When at corporate, somebody shows up and says, tell me what's going on down there in southern Kansas at our hospital, and you have to call them and say, what do you have on this particular vendor or these employees? So we understand the world that you're living in. The ability for you now is, with eyes wide open, to do a scrub. We want to talk to you about the opportunity to help you discover kind of what your risk is, and then adopting some best practices by asking questions that you're entitled and legally should be, or bolstering them on your application. So none of this, it is designed to open your eyes. If you are a little nervous based on where you think your organization, you're not alone when it comes to procurement.
Hey, Mike, one of the things that's interesting about the data integrity scrub is just the idea that it helps create the conversation across your organization, and then in a really healthy way. And so you're able to look at your data, you're able to say, you know, what do you need to be compliant, and begin to develop your processes. So we use it with a lot of our clients just on the front end to just help create those conversations. I had a question that came in. Go ahead.
Chris, I'm sorry, before you do that, do you mind just explaining briefly what is required to perform a data integrity scrub? It's not as intrusive as it may sound.
Yeah, all you need is the business name and the TIN number. And so it's 2 columns of data, and we're able to provide just a quick overview of how accurate the data is. So 2 simple things: the business name and the TIN or EIN.
And let me add too, for those of you who saw in the previous slides the kind of statistics that we were showing, that's what you would get back. But rest assured, we are bouncing the TIN number and the business entity legal name against the IRS database, but that does not in any way, shape, or form is it associated with an entity. They have no idea who we're scrubbing it for, nor would we ever share that with the IRS. So you are never added exposure by doing it. It's allowing you to have the data internally to decide what needs to happen. So I just want to make sure you understand both, you know, what that is entailing, and it doesn't expose you to any additional risk.
And I know we're bumping up on time here. There was one question that came in. They asked if you were going to start collecting the employee monitoring data. So in terms of exclusion monitoring of your vendors' employees, is there a subset of organization of vendors that you would start with? My answer would be start with your BAA. Any of your vendors that are signing BAAs, it's probably included in your BAA. So you'd have a subset that. If you look back at our statistics, almost 75% or greater of your vendors have signed BAAs. And if you wanted to narrow it down even more, any of your SDR vendors, so first tier downstream related entity, and that would probably get it a little bit lower than that 75%. But you're wanting to think about not only collecting that information, but then doing it on an ongoing basis as well.
Thanks, thanks, Chris. It looks like that was the only question that came through. So if you do have any, please don't hesitate to reach out. I want to close out by saying thanks again for joining us. Please fill out the survey that you'll be prompted with right after this. It'll help us to continue to bring value to you guys. We want to make sure that your time with us is well spent, and we just want to make sure we're talking about the things that you guys want to hear about. So please be on the lookout for that this afternoon, or the survey after the webinar, and then a copy of the webinar as well as a recording this afternoon. And please share that with whoever you think would like to hear it. And with that, I will say thanks, Mike and Chris, for being here with us today. And thank you all for choosing to spend your time with Provider Trust. This is good for one CEU, and we will get that certificate to you ASAP. So be on the lookout for that as well. We're happy to be a source for continued education for you guys. So we're happy that you joined us today. We hope to see you on our next webinar. And we all hope that you have a great rest of the week.
Thank you, everyone.
Thank you.